Welcome to this explainer. Look, if you or someone you love has been living with chronic, just absolutely exhausting pain, and every single time you go to the doctor, your lab tests and x-rays come back completely normal, I want you to know something right out of the gate. You are not crazy. You are not making this up. It is incredibly frustrating, isn't it? Feeling like your body is literally failing you while everyone around you, and yeah, sometimes even medical professionals, tells you it's just stress or that you're just being overly sensitive. Well, today, we're going to unpack the true science behind fibromyalgia. We're here to validate your experience and give you some real evidence-based tools to empower your journey forward.
So here is our roadmap for today. We're going to cover the invisible struggle, what fibromyalgia actually is, central sensitization, diagnosing by exclusion, the holistic treatment plan, and finally, taking your life back. Let's dive right in.
Section 1. The invisible struggle.
Imagine a patient who has spent years in pain. Let's just call her Sarah. So for 3 years, Sarah just hasn't felt like herself. She's got this pain in her neck, her shoulders, sometimes her back, and it just comes and goes in waves, even though she hasn't had any injuries. She is totally wiped out from the slightest effort. And get this, even after sleeping for 10 hours, she wakes up feeling like she was hit by a truck. Her family kind of thinks she's just complaining, and doctor after doctor tells her, well, there's nothing wrong with you. The core truth Sarah, and honestly so many patients, desperately need to hear is this: your pain is real, even if the tests are normal. Because without that validation, patients just bounce from doctor to doctor. They eventually fall prey to these predatory online influencers selling useless supplement trends, extreme doses of vitamin D, spirulina, or ashwagandha. And the pain? It doesn't go away. This whole cycle of invalidation and false hope is just deeply damaging.
Section 2. What is fibromyalgia? So if we actually break down the word fibromyalgia, it comes from Latin and Greek roots. Fibro means fibrous tissues, myo means muscles, and algia means pain. So literally translated, it just means pain in the fibrous tissues and muscles. Now, do you notice anything missing there? Right. The name doesn't actually tell us why it's happening or what is causing it. It literally just describes the symptom. And actually, that perfectly illustrates why this condition has historically been so incredibly confusing, even for doctors.
Now, a really crucial point here is understanding the difference between a disease and a condition. A disease, like diabetes or, say, pneumonia, has a known cause. It has clear biological markers and simple tests you can run to diagnose it. But fibromyalgia? It's a condition or a syndrome. Basically, it's a cluster of symptoms, widespread pain, fatigue, sleep issues that all occur together. But the exact root cause can vary, and there is absolutely no single blood test or an x-ray that can just magically confirm it.
But look at how far we've come, right? Thousands of years ago, women with these symptoms were tragically dismissed as being cursed. No way, right? Then, by the 1800s, doctors finally noticed a pattern and called it muscle rheumatism. In 1904, it was termed fibrositis, which actually falsely implied inflammation. It wasn't until 1990 that the American College of Rheumatology finally published the first official diagnostic guidelines. Those were later updated in 2010 and 2013. We are constantly learning more, and finally pulling this condition out of the shadows and into modern clinical recognition.
Section 3. Central sensitization explained.
Okay, let's use a quick analogy. Imagine waking up in the dark and stubbing your pinky toe super hard against a table. We've all been there, right? The pain receptors in your toe basically act like little switches. When they get hit, they send an electrical signal through your nerves and spinal cord, which act like wires, all the way up to your brain cortex. And that lights up like a bulb, telling you, ouch, my toe hurts. Normally, your healthy brain then releases endorphins, which are kind of like your body's natural morphine, to calm that pain down. But here's the kicker. In fibromyalgia, this entire system malfunctions.
Let's look at this really landmark 2002 fMRI study. Researchers took two groups, people with fibromyalgia and people without, and they applied just mild pressure to their thumbs using a rubber stopper. The healthy group felt the pressure, sure, but no pain, and their brain scans, totally quiet. But for the fibromyalgia patients, they felt severe pain, and their fMRI brain scans lit up like a Christmas tree right in the pain centers. This study definitively proves that the brain is aggressively amplifying pain signals. It totally destroys the whole fake illness myth. Your nervous system is genuinely turning up the volume on sensations that simply shouldn't hurt. You see, our nervous system can basically get trapped. We have the sympathetic system, which is your fight or flight mode, that's active during stress, emergencies, or danger. Then we have the parasympathetic system, which is your rest and digest mode. In fibromyalgia, the nervous system is often just stuck in overdrive, totally dominated by that sympathetic fight or flight response. And this constant state of hyperarousal and stress, it leaves your body absolutely exhausted, hypersensitive to light, sound, and touch, and totally unable to properly regulate pain. Section 4. Diagnosing by exclusion.
So, you might be wondering, why on earth does it take months or even years to get a diagnosis? Well, it's because fibromyalgia is a diagnosis of exclusion. Before a doctor can confidently say you have it, they literally must rule out other conditions that mimic these exact same symptoms but have very different, highly specific treatments. They have to run tests to make absolutely sure you don't have rheumatoid arthritis, lupus, multiple sclerosis, a severe vitamin D deficiency, or hypothyroidism. I know it's a long, completely exhausting process for the patient, but it's a totally necessary medical safeguard.
Once all of those are ruled out, doctors look for a specific cluster of core symptoms. We're talking widespread body pain, absolutely debilitating fatigue, and cognitive issues that we often call fibrofog, which is where your memory and concentration just kind of slip away. Patients also often have unrefreshing sleep, chronic migraines, and irritable bowel syndrome. Now, here is a massive distinction to keep in mind. Patients often feel morning stiffness, right? But unlike rheumatoid arthritis, where the stiffness improves as you move and go about your day, in fibromyalgia, the muscle stiffness and pain actually get worse with exertion. Today, thankfully, we no longer just poke at 18 tender points like they did back in the 90s. Instead, doctors use the widespread pain index and the symptom severity scale. Basically, they look for pain in 6 or more key areas of the body, like the chest, abdomen, back, arms, and legs, that has lasted continuously for over 3 months, combined with how severe the fatigue and sleep disruption are.
Section 5. The holistic treatment plan. Okay, so the absolute most crucial point here is that there is no single magic pill to cure fibromyalgia, because the causes are this really complex mix of genetics, stress, past trauma, and nervous system misfiring. The treatment has to be tailored to you. It relies on 4 equal pillars: deeply understanding your condition, incorporating specific movement, utilizing psychological therapy, and finally, careful medical management.
Believe it or not, movement is actually one of the most effective treatments, but you have to be incredibly careful. If you just jump straight into intense exercise, you are going to trigger a massive flare-up. It has to be gentle and incremental. We're talking starting with just a few minutes of walking, or even aquatic therapy, like walking in a swimming pool to reduce joint stress. Weight management is also key here, as excess weight definitely worsens symptoms. Furthermore, strict sleep hygiene and active stress reduction techniques, those are absolutely non-negotiable for calming down that overactive nervous system.
Now, when it comes to medications, we have to be very precise. Doctors often prescribe drugs that help regulate nerve pain and brain chemistry. Medications like duloxetine, pregabalin, or low doses of amitriptyline can be incredibly helpful for sleep and nerve pain. However, what is absolutely harmful are opioid painkillers, things like tramadol or morphine. They do not fix the nervous system. In fact, long-term use can actually increase your sensitivity to pain and make the whole condition worse.
I have to pause right here and issue a really strong warning. Because chronic pain is so exhausting, patients get desperate for relief. And sadly, predatory influencers and online doctors completely exploit this. They will try to sell you super expensive, totally unproven immunity protocols, high-dose vitamin D, ashwagandha, or tell you your pain is just a magnesium deficiency. While basic vitamins are totally fine if you're actually deficient, they're not a cure for fibromyalgia. Please, do not let these people commercialize your illness and sell you false hope.
Section 6. Taking your life back. Managing fibromyalgia is really all about building a sustainable daily routine. Cognitive behavioral therapy, or CBT, is highly recommended to help you cope with the mental toll of chronic pain and reduce the anxiety that triggers flare-ups. You absolutely have to learn to pace your energy. Don't overdo it on a good day only to completely crash the next, right? It's also vital to treat co-occurring conditions. So if you have IBS or migraines, get those managed so they aren't adding fuel to your nervous system's fire. With the right medical team and a solid support system, many patients go on to live highly functional, beautiful lives.
So, I want to leave you with this final thought. Are you ready to stop searching for an overnight magic cure and instead commit to building a sustainable, pain-managed life? It's time to tune out the online noise. Find a specialized medical professional who actually validates your experience and start taking those small, incremental steps today. Your pain is real, for sure, but so is your path forward. Thank you so much for joining me for this explainer.